Well, some doctors are calling for more research into the side effects of the popular weight loss and diabetic drug Ozempic and Wegovy.
Medical professionals are warning the long-term impact of using the drugs is not known. So for more, we're joined by Dr. Timothy Quinn with Quinn Healthcare in Ridgeland. Dr. Quinn, thank you for being with us this afternoon.
Hey, thank you for having me.
What are doctors worried about with Ozempic and Wegovy?
Well, first of all, I want to identify that Ozempic and Wegovy are two medications made by Novo Nordisk Pharmaceutical Company, and they have the same active ingredient, semaglutide. It's just that the Ozempic is FDA approved with the clinical indication for diabetes, and the Wegovy is the name given to the form of it that's FDA approved with the clinical indication for weight loss, but they're both the same active ingredient, which is semaglutide, that new class of medications that started out used for treating diabetes, very effective, but a lot of people that use the medicine for diabetes, they had the side effect of losing weight. So the pharmaceutical company got the clinical indication for weight loss, but they used a different name called Wegovy. That side effect that everybody is concerned about is GI irritation. Some people have nausea, vomiting. Some people can have gastric paresis, but the deal is it's very rare. And if a person takes the medication properly with their medication over time, increasing the dose very slowly, in most cases, they don't have those complications. So that's something that really needs to be put out there.
Dr. Quinn, I've heard the term stomach paralysis associated with these drugs. What is stomach paralysis?
Well, the medical term would be gastroparesis. And that's a condition where a person is unable to move their food contents through their stomach. It can cause a lot of pain. They can end up in the hospital. Now, the deal is the medication can possibly contribute to that as a side effect, but it's very, very rare. As a matter of fact, if you look at any medication, there's a possibility of a side effect. For instance, Tylenol has the possible side effect of liver failure, but that doesn't mean you're going to have liver failure. But people who typically would get liver failure from Tylenol is if they take too much and not as prescribed. But with these medications that we're talking about, the Wegovy, the Ozempic, if you follow up with your medical doctor and take it as prescribed, where you start at a very low dose, and every month we evaluate the patient, and if it's tolerated well, we can progress to the higher dose, then the chances are so low. In a lot of cases, as I was told by one of my ER physician colleagues, a lot of people that end up in the emergency room are taking the medication improperly. Maybe, for instance, they heard it'll help you lose weight. They'll use their grandmama's medicine, and she's been on it for a long time, and they'll take it at the highest dose and never taken it before. And in a lot of cases, they'll end up in the emergency room. But the take home is any medication is the most safe if you take it as prescribed by your medical doctor and follow their guidance, and that's the safest way to take any medication.
Dr. Quinn, who is this impacting more? Patients taking it for weight loss or those taking it for diabetes?
Well, honestly, the people that are impacted the most in the negative effect of getting those terrible side effects are people that are improperly taking the medication.
Okay.
As I said before, with the medicine, we started a very low dose, 0.25. The next month we go to 0.5, and then but we monitor the patient and assess, are you having any nausea, any vomiting, any stomach pain? And if they are, then we can make a clinical decision to go to the next higher dose or stay at that dose or maybe even terminate the medication. But the take home is you have to follow up with your medical provider and don't take grandma's medication.
Well, one more real quick question. We talked about this, well, you gave the medical term. I'll use the layman term, the stomach paralysis. Is this a permanent condition? I mean, once you get it, does it stay that way or does it go away after a while?
For most patients, they can be treated, but first you have to figure out what the cause is. As I said, some people that are on the medication, say for instance, Ozempic or Wegovy, they might have diabetes, especially Ozempic, because remember, Ozempic is clinically indicated for people with diabetes. Diabetes is one of the #1 causes of gastroparesis where you have problems, but the take home is it can be treated, and in most cases is successfully treated, and the person can live a very healthy life.
All right, you've given us some good advice. Take medicine that is prescribed to you, and see your doctor regularly for those checkups to make sure you're taking it properly and it's working. All right. Thank you very much, Dr. Quinn, as always.